ketogenic diet was published over 100 years ago by a doctor at the Mayo Clinic, Russell Wilder. And he was both an epilepsy doctor and a diabetic specialist. And he was using ketogenic diet therapy for both types of patients. And he found that they improved. And so he published this in a medical journal, and it's been studied for over 100 years now with several randomized controlled trials. Now, I've been using it for epilepsy for about 30 years, but recently there's some studies in other neurological conditions and other brain disorders like cognitive impairment, but also now more recently for diabetes and for mental health disorders, severe mental health disorders that are not responsive to traditional medications. A well-formulated ketogenic diet can be sustainable forever. And I have patients that I started with when they were little children, and now they're adults, and they're fine because they are getting good quality diet. Most of them are on nutritional supplements because they might not be able to get something like carnitine from their food, which is an important amino acid. So then we supplement them. So this is the reason why people should not do this on their own, why it should be medically supervised and implemented with somebody that has experience. I think 12 different countries where I've trained professionals who have gone out and implemented this in their patients. So yes, many, many people, and again, not just for epilepsy, for other neurological conditions. And I want to highlight metabolic genetic disorders, which are fairly rare, but there's many of them that we know that respond to a ketogenic therapy. So I work with people that have these rare disorders, and those tend to be the people that are on ketogenic therapy for their entire life because they were born with this genetic disorder and their body isn't using glucose properly in the brain, so they get their brain fuel from ketones. So again, those people are on keto for their life and they can be perfectly healthy.